Hi everyone, thanks so much for joining us. My name is Jackson Fairchild. I'm the Head of Policy and Programs at Rainbow Health Victoria, and I will be your host for today's launch. Before we start, I'd like to take this moment to acknowledge the traditional owners of the land on which we all work today. For me, that is the Wurundjeri people of the Kulin Nation. I'd like to pay my respect to their elders, past and present, and extend that respect to all Aboriginal people joining us here today. I'd also like to acknowledge the leadership of Aboriginal peoples in the ongoing work of preventing family violence. Always was, always will be Aboriginal land. Rainbow Health Victoria is delighted to welcome two very special guest speakers who will be opening today's launch. Our first speaker is Gabrielle Williams, the State Minister for the Prevention of Family Violence. Minister Williams has been a great support for this ongoing work and was present to open the launch of our Prevention Evidence Guide in July last year. Thank you so much for joining us, Minister.
Thank you, Jackson, and my pleasure to be able to join you here today. Let me also begin by acknowledging the traditional owners of the land on which we're gathered and pay my respects to elders past and present, noting, of course, we're all on different country here today in this virtual world that we're becoming strangely accustomed to. Let me also acknowledge the team at Rainbow Health Vic, Jackson and others, for having me along, but no, not just for that, for all the work that you do and the panellists and presenters we have here today, which really is a who's who and some great expertise on display and wisdom, no doubt, as well. It's really great to be able to join you and have the opportunity to just say a few words and help to launch the Pride and Prevention Communications and Engagement Guide. It gave me cause to reflect on the fact that 5 years ago, the Royal Commission into Family Violence handed down its report, and to think about the journey that we've been on in that 5 years. And I think it's fair to say it's been a very steep and challenging journey, but one that has had along the way some really significant achievements. We've so far invested over $3.5 billion in rebuilding our family violence system and in stopping violence before it starts. But I think one of the key things to underpin that work has been the awareness and firm acknowledgement that inclusivity must underpin the way that we communicate about family and partner violence. We know that this is crucial to breaking down the stigma that often attaches to this kind of violence within particular communities and to encouraging people to speak up. So we know, really understand and increasingly appreciate, in no small part due to the work of organisations like Rainbow Health Vic, the importance of communities, in this case particularly the LGBTIQ community, in seeing your identities and situations reflected in the messaging that you receive around equal and respectful relationships. We know how important it is to also build protective communities around victim survivors, and that ultimately those protective communities, these protective environments that we create by building knowledge bases as well, are really key to stopping violence before it starts. So for all of these reasons and many, many more, I want to congratulate Rainbow Health Victoria on the release of the resource that you're celebrating today. I know it will complement the evidence base that's being established through so much other work that is taking place through Rainbow Health Vic and many other partners along the way, and is really, from our point of view, from a government point of view, central to the implementation of our family violence prevention strategy, Free from Violence, and so much of the other work that we're doing to make sure that our reform reaches all Victorians and presents information in a way to them that is relevant and that is useful, and that we're not being blind to the circumstances of so many in our community, and that we're not perpetuating any suffering and silence that we know happens far too often. So I want to thank you for your continued work to build sector capacity and to develop programs that are sensitive to the needs of LGBTIQ plus communities, and to ultimately say that on behalf of the Victorian Government, particularly the Andrews Labor government, we're really proud to partner with you in these efforts and look forward to having a long partnership into the future in being able to kick some real goals, I think, in what is without doubt a shared objective. So thank you very much and well done on all your work that you have done and all the work that you'll continue to do.
Thank you so much, Minister. Once again, thank you for those powerful words, and thank you for your profound support and allyship for the LGBTIQ community in this work going forward. I'm pleased to welcome our next speaker, Todd Fernando. Todd is the Acting Commissioner for LGBTIQ Communities. Commissioner Fernando is an accomplished diversity and inclusion consultant and doctoral researcher with extensive experience working with First Nations and LGBTIQ communities. Thank you so much for joining us today, Commissioner.
Thank you so much for having me, Jackson. Can I acknowledge that as a descendant of the Kalari peoples of the Wiradjuri Nation, now known as Central New South Wales, I acknowledge that I meet on the lands of the Wurundjeri people of the Kulin Nation here in Naarm. I'm honoured to be able to join you all today as we launch this incredible resource. Minister Williams, can I acknowledge your unwavering support not only for LGBTIQ communities, but for your work supporting the self-determination of Aboriginal Victorians and the vital work you do to champion the success of Victorian women. Can I also acknowledge the work of Ro Allen, who not only held this role for 6 years, but has been central in transforming the LGBTIQ landscape for Victoria to truly become the equality state. Their work and their legacy will continue, and I wish them well in their new role as the Victorian Equal Opportunity and Human Rights Commissioner. The impact of family violence really has never been too far from my view, and I want to take this opportunity to acknowledge the many women who in my life have survived and now thrive despite the experiences of violence that they have faced. No one should ever have to experience family violence, and no child should ever have to witness family violence growing up. But unfortunately, this remains the case. Family violence, sadly, does not discriminate. It occurs and affects many families across multiple intersectionalities and communities here in Victoria, across Australia, and indeed worldwide. The development of the Victorian sector to respond to family violence has gone from strength to strength, from the original Royal Commission, as Minister Williams pointed out, to having a government that has seen so many of those recommendations be put into action. Organisations like Rainbow Health Victoria and others who have contributed to the development of resources like crime prevention are why this sector is enhanced year after year. But the work is not complete. For decades, we have seen how hard it is for families and communities to find culturally appropriate and responsive safe services. Our work to support communities of colour, Aboriginal and Torres Strait Islander people, and of course LGBTIQ people must be ongoing, and it must be intersectional. In addition to Rainbow Health Victoria, can I acknowledge the work of other organisations who do so much to provide critical care for our communities? Organisations like Switchboard and Rainbow Door, Drummond Street, Thorn Harbour Health, Transgender Victoria, Multicultural Women's Health, and Our Watch, to name a few, along with many other organisations that honour our intersectional communities by putting our issues at the core of the work that they do. Because when we talk about LGBTIQ people, it's much more than a single group of letters. Each of those letters have different experiences, and we know the high rates of partner violence, bisexual people, for trans and gender diverse people. We know of families who have rejected children because they have an intersex variation. We know how isolating it can be for gay male victims of partner violence with no appropriate shelters to go to. And of course, we understand the struggles and intensities of lesbian relationships when they break down. And each and any of these people can also be Aboriginal. They can also be a person of colour or dealing with disabilities or mental health issues. Intersectionality isn't a neat add-on or a tick box exercise. For many of us, our intersectional identities add up to who we are. And so intersectionality isn't really a government buzzword of the day, but really it's a way of life. While increasing our attention and our awareness to primary prevention is a critical tool for ensuring family violence is at the core of the work that some of our organisations do. Organisations and actions need to provide care, and that support cannot go unnoticed. One of the most exciting things that I witness in my role as Acting Commissioner is seeing organisations and their champions meeting people where they are. That method of sitting and listening to community needs and challenges and co-designing responses is something that the rest of Australia and indeed the world can learn. This particular resource provides a significant opportunity for mainstream organisations to play their role in supporting those experiencing family violence and contribute to actions that decrease those rates over time. There is no more excuses really for organisations not to play a role in this space. The evidence is overwhelmingly available And for a while now, we've known the drivers of family violence and the methods to tackle these issues to ensure primary prevention occurs across all levels of service delivery. So if you're an organisation that is listening in and feel as though that your organisation hasn't done enough, now is the time and now is the opportunity to really partner with organisations that are leading this change. Don't delay, because there are families and individuals right now experiencing violence in their homes. For many queer people, family violence isn't necessarily from a partner. COVID-19 and necessary lockdown measures means that there are families currently in homes with perpetrators. There are young LGBTIQ plus folk who have little choice but to code switch and minimize their queerness or gender identity more to ensure that outbursts of hatreds do not occur. So whether it's a young person or parents who reject them, or family members persecuting a parent who happens to be transitioning later in life, family, the place that is supposed to be a space in which that protects us, can sometimes be that source of violence. So those are the people who I'm thinking of today as we launch this incredible resource. They are the same people that we all thought about when designing these guides and action plans. We are learning to have the tough conversations in our communities, and I'm really pleased that those conversations have begun, but those conversations must always intersect along race, culture, gender, and of course sexuality. So the delivery of evidence-based programs must ensure that the intersections of our communities play a role in how we design and support those experiencing family violence. And the essence of what I'm trying to say, I guess, is that these conversations are difficult because the situations are so complex. But each day, each conversation gets more accessible because of the resources like the Pride Prevention Guides and resources that other organisations publish. So can I congratulate everybody involved and to everybody across the sector. Your ongoing commitment to preventing family violence is so incredibly needed and does provide the support where it counts. So congratulations to everybody and thank you.
Thank you so much, Commissioner, for your powerful words. It's so important for us to name the urgency and to speak about the importance of action now, especially during these difficult and challenging times. And thank you also for acknowledging the work of Ro Allen in this space. Commissioner Allen was present at the launch of Pride and Prevention at many of our resources, and we're very grateful for all their support in helping bring this work to bear. Without further ado, I'd like to introduce the Director of Rainbow Health Victoria and the Head of the LGBTIQ Primary Prevention Project Team, Marina Carmen, who will give our keynote presentation. Thank you so much, Marina.
Thanks so much for that, Jackson. Just get my slides. Yep, good. I would also like to start with an acknowledgement of country and pay my respects to elders past and present. I'm coming to you from Wurundjeri land, and we know that there are people joining us from all over the country for this event. As always, we also like to pay tribute to the rich history of the feminist movement and the many LGBTIQ activists who have gone before us and paved the way for us to be in these sorts of spaces today talking about these really important issues. So we're once again, very pleased to be here to launch a gorgeous new resource brought to you by the team at Rainbow Health Victoria. It was only just over a year ago that we launched Pride in Prevention, and it really was a resource whose time had come, something that gathered all the necessary information in one place and gave us the tools and the language to talk about primary prevention for LGBTIQ communities across the various sectors engaged with and interested in this issue. It's been downloaded thousands of times, it's been quoted, used in policy documents, and the team has been really pleased to be invited to speak, to give advice, and to participate in debates and conversations. It's been a really fantastic impact of the Pride in Prevention evidence guide that we launched last year. Pride in Prevention was made possible through this project funding from the Victorian Government, and we're very grateful for the support. And now we're ready to begin bringing you the results of phase 2 of this project with the launch of our Pride in Prevention messaging guide today. So looking back at Pride in Prevention, it's important to say that we didn't start from scratch. We really drew on any existing work we could get our hands on. And that included existing research, looking at prevalence and dynamics, as well as theoretical approaches to the drivers of violence against women, existing policy frameworks, particularly Change the Story, and an analysis of existing initiatives and interventions that could be considered and understood as primary prevention. And we realised that there's a lot to be learned when putting it all together in a new way. A key outcome in Pride in Prevention was the development of a proposed model for the drivers of violence experienced by LGBTIQ communities. This hadn't been done before, though it drew heavily on the multi-level socio-ecological model used in Change the Story. And the model has really pointed the way towards better understanding and acting in informed ways against the drivers of violence. So the point we make in the resource is that the drivers of violence for LGBTIQ people are the same as the drivers of violence against women, rigid gender norms, but also distinct while being inextricably linked. So rigid gender norms are closely related to both cisnormativity and heteronormativity. And essentially this means that there's the ideas that male and female and heterosexual relationships are the only natural and normal ways to be, and that there's something wrong with bodies, identities, and relationships that sit outside of these norms. So these common and interlinked drivers mean that the sectors looking at and responding to these issues need to work together. And this includes organisations working in and for LGBTIQ health and wellbeing, equality and rights, and organisations working in and for the prevention of violence against women, gender equality and women's health. And we proposed in the resource a series of essential actions to target the drivers and put forward some initial suggestions of priority points for intervention. Well, we've now followed this all up by putting it into practice further through a focus on communications and engagement. And again, there's much to be learned from decades of existing practice in messaging for prevention of men's violence against women, as well as campaigns for LGBTIQ rights and equality. And the approach we've taken in the resource is not to try to give all of the answers, but to put forward a range of key principles and best practice approaches, things to keep in mind, and to encourage action guided by these, which can be evaluated and tested further. A key feature in the messaging guide is supporting ways to talk about both violence against women and violence experienced by LGBTIQ communities. So a focus on men's violence against women is justified by a strong and growing research base that's clearly established the prevalence and dynamics of this violence, as well as key features of effective prevention and service responses. However, we need to continue to do this in ways that simultaneously challenge the silencing and exclusion of LGBTIQ communities, and that will continue to challenge and begin even more to challenge binary and heteronormative understandings and approaches. Similarly, primary prevention messaging for LGBTIQ communities must be done in ways that don't inadvertently feed denial of the impact of sexism, gender inequality, and men's violence against women. So a gender transformative approach is highlighted in our Pride in Prevention resources as an emerging and growing approach that aims to challenge violence against women and violence against LGBTIQ communities simultaneously, paving the way for choice and acceptance and celebration of a diversity of bodies, genders, sexualities, social roles, and relationships. We really had a great time putting together this resource and delving into each of the key areas that need to be looked at in designing messaging. And as I said, the approach we took was to lay out the process and some principles, not to give definitive advice, but rather to give people some tools and encourage people to think and really try it for themselves. But we learned some things ourselves in thinking all this through, and we thought we'd offer some of these here to you today to keep in mind. What we've realised is that the most important place to start is to be clear and precise about the problem being discussed in any messaging. For example, is it intimate partner violence, parental violence, sexual violence, etc. This helps us to define the aim of the message and the intended action or change that it seeks to promote and with which audience in mind. In doing this, it's important to draw upon and reference research that demonstrates the prevalence, dynamics, and solutions to the problem. And this means looking at the impact of the problem for different groups within LGBTIQ communities and how this might be similar or different to how the problem plays out for women or for other groups. For LGBTIQ people, often this research doesn't yet exist, and this should be acknowledged, and it helps to advocate for it to occur in future. We've realised that focusing on social drivers of violence is a really important way to avoid pathologising LGBTIQ people and their families and relationships. And it's the best way to think through the direction of change that prevention messaging aims to achieve. No matter what, the key to understanding the problem and making messaging effective is to centre the voices of the people impacted, LGBTIQ people. We want people to take up a leadership role and champion LGBTIQ communities, but nothing about us without us is the golden rule. Another thing that we really took to heart is the need to focus primarily on solutions to the problem. And this allows you to take charge of the conversation by putting forward positive visions of choice and freedom. So as we present this new resource to you today, we're part of important shifts beginning to take place in policy discussions and cross-sector conversations. And this is in no small way driven by pride in prevention and by recent steps forward in research that can inform policy and practice. Private Lives 3 has delivered recent, robust and high quality data on LGBTIQ experiences of family violence. This is the largest ever national survey of LGBTIQ health and wellbeing, and confirms a picture of significant experiences of family violence, much of it driven and related to inequality and discrimination against LGBTIQ people. We've also had the report of the Senate inquiry into family, domestic and sexual violence, which made a number of recommendations around the need to improve data and research on LGBTIQ experiences, the need to fund an LGBTIQ specific national primary prevention framework, and the need for a greater policy and service focus on LGBTIQ experiences. Our Watch is working on the new iteration of Change the Story and has made a commitment to explore the intersections between the gendered drivers of violence and other forms of oppression and discrimination, including the crossover of the drivers of violence experienced by LGBTIQ communities. Rainbow Health Victoria is also collaborating on a key national research project mapping existing service access and pathways for LGBTIQ communities. And we're participating in a range of consultations around LGBTIQ inclusion in the renewal of the national plan. Here in Victoria, we're also continuing to deliver the LGBTIQ family violence sector capacity building project funded by Family Safety Victoria. And we'll be making a range of recommendations from our LGBTIQ family violence prevention project. This project is supporting 2 LGBTIQ community-driven primary prevention campaigns, which will launch in coming months. So keep a lookout for them. They're fantastic. And we're extremely grateful for the collaborative and enthusiastic support for the project from across various government departments and teams within government, and also from the sectors engaged with the work. So what we think we're looking at here is a critical mass of research, data and experience through delivering initiatives that allows us to make an increasingly clear and compelling case for appropriate and meaningful inclusion. So we look forward to working with you all further into the future to make this happen.
Thanks so much, Marina. And for those of you, I mean, I feel excited listening to that. It really is a compelling vision for the next stage of this work. And for those of you who have yet to download a copy of this new resource, we'll be sharing a link to that in the chat now. And we encourage you to download it, share it with your friends, take it to parties when those are a thing again. We really look forward to more conversations about that in the future. Well, once again, we are absolutely blown away by how many people have joined us here today, despite the ongoing lockdowns across the country. We have had over 400 registrations from all across the LGBTIQ family violence community and health sectors all over Australia. And we're all here because we are working towards a shared vision of a better world. A world where everyone lives happy lives, free to love and to be loved and to be celebrated for who they are. Who we are. We know that rigid ideas about gender and families and systemic gender inequality leads to high rates of gendered violence. This includes high rates of men's violence against women and high rates of discrimination, prejudice and family violence affecting LGBTIQ communities. These ideas and systems are entrenched at all levels of our society. In order to shift this, we are going to need to work together. We know that our actions can be greater than the sum of their parts, and we talk about the importance of a coordinated, mutually reinforcing approach where we work together towards those shared goals over time. LGBTIQ prevention is still in its early days. Luckily, we don't need to reinvent the wheel. Since the inception of this project, our team has had the pleasure of building partnerships and connections with a range of organisations and projects working to prevent family violence and violence against women across Australia. I've got to say, these conversations have been absolutely transformative. They have sustained us, inspired us, and expanded the way we think and work. We've also been motivated by their willingness to learn, listen, and to take the lessons of our work into theirs. So today we've taken a bit of a different approach, and we've invited 3 guest experts from across the primary prevention sector to join us in a panel conversation as we reflect on what we've learnt and look forward to the next phase of this work. I'd like to welcome our first panellist, Regina Torres-Quiazon, who's the Research Advocacy and Policy Manager at the Multicultural Centre for Women's Health. Regina has a PhD in Cultural Studies, over 20 years experience working in gender and diversity as a project manager, researcher and educator. Regina has significant expertise in the theory and practice of intersectionality, and since joining MCWH in 2009, has led the development and delivery of several projects, including the first primary prevention of violence projects specifically designed to engage migrant aged care workers in Australia. Next, I'd like to welcome Emily Maguire. Emily is the previous CEO of Domestic Violence Resource Centre Victoria, DVRCV, and is a leading voice in the prevention of violence against women nationally. She has worked across both government and community sectors in program design and delivery, public policy, advocacy and education. Emily specialises in approaches that address the drivers of violence and prevent violence against women before it occurs, and has played a big part in the development of the Change of the Story framework that we'll be talking about a little later. And lastly, I'd like to welcome Sarah Hewitt, Senior Policy Advisor at Our Watch. Sarah is a researcher and policy expert with a PhD in Politics and International Relations, specialising in gender violence. In her work, she has engaged extensively with government policymakers, non-government organisations and civil society advocates, as well as scholarly communities on that topic. She recently led a joint Our Watch and Respect Victoria research project, seeking to better understand and monitor the response to resistance and backlash to primary prevention of violence against women. Thank you so much for joining us all here today. All right. We've got everyone's cameras on. Thank you so much for joining us, everyone. Now, to start us off, Emily, as I mentioned, touched on earlier, you've been closely involved in the ongoing development of Change the Story, which is the national framework that guides the prevention of violence against women work. The preliminary model and priority actions that we proposed in Pride and Prevention were designed to align with Change the Story. Can you tell us a bit about what having a shared framework has meant for the prevention of violence against women sector?
Absolutely. Thank you so much for having me. And thank you, Marina, for that. I agree. It was sort of really nice and uplifting, particularly in lockdown times, to get really a bit of a snapshot of the work that's been happening in the LGBTI space, which has been, led in Victoria. It's my jurisdiction, so don't like us saying that. When I think about what a shared framework has meant for the work in Victoria and in Australia around preventing violence against women, the first thing that's popped into my mind is that whilst there's a whole bunch of practitioners who use the Change the Story framework and who use the initial Vic Health framework that was developed in 2007, similarly to those who use Pride and Prevention framework, those frameworks are not necessarily for practice. Practitioners use them, but they're actually policy, they're conceptual frameworks. And I think that is the real benefit. They need to be translated into practice. But one of the benefits of having a policy framework is that it gave us shared and consistent language. It galvanised a sector that was not splintered or disparate by any stretch of the imagination, but talked about things in really different ways. It's the language piece was really important. It really helped us, I think, articulate what the strategies were, and it gave us a sense of, right, we've now really got we've got one place, I suppose, where all of the evidence all of the evidence sits in terms of what drives violence against women, as well as what can be done to address it. When I was thinking about this question, Jackson, the thing that popped into my mind is I think any left movement suffers from the requirement for everyone to agree 100% on everything 100% of the time, which has always been kind of flabbergasting to me. And I think it's the same in the LGBTI space as in the violence against women sector. That sense that division is one of the worst things that is possible, because it kind of waters down your message. And so I think the process that we used around the first Change the Story framework has actually been one of the things that's gotten us to a place of having that shared messaging. It's not that you want everyone to say the same thing at the same time. You don't want us to be robots, and you don't want to create a culture where there isn't disagreement and constructive conversation, because that's also really critical. But when you are talking to policymakers or to people in the community or to ministers or to commissioners, you need to be able to sing from the same songbook, so to speak. And I think that the process that we used in developing the first Change the Story allowed us as a sector and as a movement to have those conversations where we disagreed and we challenged each other. And it wasn't about everyone necessarily getting their opinion heard. It was about everyone being able to talk through the evidence and what that evidence meant, and then come to a shared position of, so how do we communicate that to the rest of the country?
It sounds like an amazing process, and I'm just really hearing that process of working together really helped build that coalition and those partnerships and connections that would allow for ongoing reflection and critical reflection as you go on, because we know that new evidence emerges, new challenges emerge, and if you've already got that conversation happening and working really beautifully, it just sets such a great groundwork for that.
Absolutely, it did.
Yeah, love the way you described that. And we talk about that phrase. I mean, there's a lot of buzzwords that we use in this work, and we often talk about mutually reinforcing. And I completely agree with you that it's so important that we don't be robots, and that we think and be creative and continue to innovate and try out new things in this work. But when we talk about mutually reinforcing, what does that phrase sort of mean to you?
For me, the concept of mutually reinforcing is something that is one of the most critical elements of prevention work, and at the same time is one of the least understood. It does, you're right, it gets used as a buzzword and just chuck it in the middle of a sentence and hope that no one asks us to explain it sometimes. I think prevention work at its heart is about challenging very deeply held behaviours, attitudes, norms, systems, structures, and about challenging our own personal identities when it comes to who we are as women, as men, as people who have genders, as non-binary people, as people in relationships. So it's really hard and confronting. The mutually reinforcing piece is really critical because of how hard the work is and how deeply held all of these things are for us. So mutually reinforcing at its heart means that you want to get similar information tailored to your audience or the context in a range of different ways. So it's not about, again, hearing exactly the same thing. It is about understanding that talking about prevention when in a workplace to you as a professional is, I would use different evidence, I would use different arguments, I would articulate things differently than if I'm talking to you in the context of your relationship, or if I'm talking to a young person and a teacher. And it's really what the evidence tells us is that if individuals get different messages in terms of the spoken messages, but different messages about social norms from a range of different places that all kind of mutually reinforce and bolster and support each other, then that is the thing that will make change stick. Respect for relationships education by itself, exceptional. But what happens when those kids go home? What happens when those kids go to the local sports club? What happens when those kids, turn 18 and go to the pub? That's the concept of mutually reinforcing that, and that's why a coordinated national approach to prevention is really important.
Oh, that's a beautiful description. And for our audience members, if you pick up Change the Story, if it's the first time you've seen it, we really do recommend you familiarise yourself with it, as it's a fantastic set of tools and an innovative way of thinking. And they talk a lot about the idea of settings in the document, and we talk about all the different spaces and places where people experience different messages, and that they're experiencing different messages at different times. And I love the way you described, Emily, around that when they leave one setting and go to another, they may get a contradictory message or a complicating message. So the amount of times they experience it in different places in different ways helps really reinforce that and help it become the new normal. And you know, we talk a little bit about that in our guide as well, about the importance of being intentional and of being really clear about what we're trying to approach, what issue we're trying to address. In our conversations, we've often explored the shared and overlapping drivers between the prevention of violence against women and LGBTIQ prevention work. And we know, of course, that it's often necessary for us to focus on particular forms of violence at different times to achieve that targeted change. With that in mind, given the shared focus on gender between these two areas of focus, what would you see would be the benefits of our different areas of focus, our different sectors, if you were working together?
For me, I mean, there's a million, but the kind of couple of biggest ones that I would pick out is about what you learn. I think, you know, you and Marina both referenced that, as did the Commissioner. It is the kind of lived experience, the kind of voice of lived experience that you get by talking people in different communities and different people in different communities. We've all got multiple identities. We've all got multiple experiences of the social systems that we live within. So learning from each other, I think, is really critical, because what it means is that you get a much better. I've had such an exceptional education working with Rainbow Health about how to articulate what those similarities are, as well as what are the good ways to talk about the differences. And talking about differences is, there's no problem talking about differences. It's not about opposition. It's about being clear, and it's about making sure that you are really properly addressing the issue that you're trying to tackle, I suppose. I think Marina's point in her presentation about where you're talking about intimate partner violence or violence between a parent and a child, like those are all important aspects of violence, but they're different and they will have different impacts on people, and we've really got to learn from each other about that. The other, I mean, and somewhat related to that really for me, is about building those really strong, robust relationships where you've got enough trust, or you build enough trust to have those really conceptually tricky conversations. Like, that's the stuff that's going to drive our work forward, when you feel comfortable to say, I don't understand why you're approaching it that way, or I don't know what that terminology, i.e. mutually reinforcing, means. Can we have a conversation about it? Or I don't understand how to apply that. Or can I ask you some questions about how to effectively communicate to this particular population group? But in order to be able to have those conversations, you have to operate from a position of trust. And that's really hard, I think, a lot of the time, but it is the only thing that is going to drive our work forward. If we can actually know that we've all got a common enemy in many, but in patriarchy essentially, and that if we can work together and trust each other and educate each other, I think that's one of the kind of fundamental pillars of both our works moving forward in the prevention space.
No, absolutely. There's so much to be learned from each other, and I love what you said about not getting caught up in too much of an echo chamber, and being able to compare and contrast the different ways of thinking and different approaches, and just how sort of a fertile conversation that can be. Regina, is there anything you would add to that?
Yeah, I like what you said, Emily, about having those tricky conceptual conversations, especially around, mutually reinforcing, because I think very early on in the piece, when we were having conversations about the first framework, especially when we're talking about migrant and refugee communities, and especially women of colour, and I guess words really, as we all know, are quite political and mean so much, that gender, in some ways, just talking about gender drivers for us didn't feel enough, or because we also needed to talk about other drivers that intersect with the gender drivers, but that in some ways, if you have a lived experience of racism, isn't something that we would call mutually enforcing. Yeah. So, and I think we still talk about, and I guess since the first development of the first framework, and 5 years later, we've continued to have these conversations, and I think they've been really productive in terms of clarifying exactly what we mean when we talk about how everyone experiences the drivers, the gender drivers, in very different ways. And I think we have to continue having those very difficult, but can also be quite enjoyable as well, conversations about what those experiences mean in specific contexts as well.
Yeah, beautifully said, Regina. And I think about, we don't often get a lot of time to pause and actually compare those different experiences. And really, we often talk about them in a particular way. We talk about, prevalence, and we talk about the research, which is incredibly important, but there's not a lot of spaces to look at what sort of sits above that and what connects those experiences. Obviously, many experiences are different, and talking about those experiences themselves can be a charged topic, as they often, we're talking about people's very personal lives, but there's not a lot of spaces or opportunities for us to have those conversations, I feel. And I feel like when we bring together and talk about our work together, it's an opportunity for me all the time to reflect on LGBTIQ experiences and my own experience and the experience of my peers and the people I've supported over the years in really real grounded terms, and bring it into focus, take it out of the conceptual and think, wow, there's some real similarities here. And when I've listened to the experience of women, cisgender heterosexual women, noting the similarities of experience and the empathy and shared humanity that can come out of that, it can be really profound.
Yeah, and I guess it becomes really tricky for us, those of us who are really lucky enough to work, with organisations in the sector where our professional and personal identities, there isn't such a big gap. And for an organisation like the Multicultural Centre for Women's Health, where, we are all from migrant and refugee backgrounds, representing women from refugee and migrant backgrounds, it can get really tricky, and we can fall into, putting a focus on identity, perhaps at the expense of, shared vision around social justice outcomes. And I guess that's not the same as saying that identities aren't important, because they are, and representation of the issues and our identities are very important. But I think it's, we really need to think about focusing on structural issues, systemic issues that need fixing, because it's not the identities that need fixing. As we know, it's those perceptions about the identities that actually where discrimination arises.
Absolutely. As I was hearing you talking, I was thinking about the temptation in the LGBTIQ sector. Sometimes we talk about like the LGBTIQ people over here, and then there's these other people over here, and that in fact there's not a huge amount of crossover, and it comes up in the general work of the women's sector all the time, where there's a terrific amount of LGBTIQ people in that space. And I love what you said about seeing on the structures and what sits above. And we've seen a lot of conversation around intersectionality in the family violence sector, which has been really great. And, those conversations, I think, have taken on different shapes and forms at different times. We've seen the government take an active role in that as well. We often see a focus on that in tailoring individual initiatives for specific communities, or deepening that understanding of specific experiences of individuals. But I'm wondering, what you just said about deepening our understanding of the drivers themselves, what might they sort of look like if we were to increase our focus on that rather than on the individual?
I guess that if we're looking at the drivers, and obviously, the Commissioner had actually, and Marina also had mentioned that a lot of what we know already is evidence-based. So I think the key question is also thinking about the evidence. What are we counting as evidence? Who decides what it is that we're going to base our policies on? Because at the moment, I've got to mention COVID. It's only taken about 15 minutes. As we know, we're trying our best at this, and it's a very good case study in trying to put forward evidence-based policy but leadership is failing us, and we can see that. And we can see that happening also with the environment and, you know, Climate Code Red at the moment. So I'd really like to think about, you know, what is it we're counting as evidence? Because for migrant and refugee communities, especially when we're looking at good policies, it's very hard to know if they're not counted, you know, in research, or if research isn't focused on those who have been most impacted by particular oppressions and discriminations. And I think we already know quite a bit, and especially in the 5 years since Change the Story has come about, there's been a plethora of research in terms of what's happening to those who have been most impacted by violence that's perpetrated by men. So I think we need to go back to the history. I think we need to think about history as part of the evidence base as well. And that includes things like, you know, a history of colonisation, migration history, histories around LGBTQI activism as well, to think about what's counted. And I think there's been a missed opportunity with the current census as well, with not having sexuality included in the census. But it's all those things that we have to think about that we normally wouldn't think about as the evidence base. And for me, I think thinking more deeply about history and context should count towards what we also consider as making up for those mutually reinforcing factors around gender drivers.
I love what you said there, and I love that focus on history is so provocative to me. And I think about the role of LGBTIQ history. We often talk in our work about the shared work between LGBTIQ liberation and women's liberation, and that you look at all the protest signs of those beautiful moments in history, and they were made with the same textures and the same cardboard, and you know, it's a lot of crossover in those movements, and in fact some ways the professionalising of that work has taken us in different paths, but that's not how things were organically, because of course this is the work of gender and relationships. And you know, I think about the work when you were talking about drivers and Change the Picture's work around identifying colonisation as a driver of violence, and how it was also a vehicle for particular bringing particular rigid ideas, rigid gender norms, violence supporting attitudes and gender inequality to this land, and you know, where those things cross over and intersect. And we just need so much more research to understand how these different things interact and cross over, and also to understand how what our different interventions mean and how they might benefit and work towards building that future.
Yeah. And I think I was about to say, I'm trying to recall the James Baldwin quote about, I think, you know, history, you know, we call history history because it's our way really of avoiding responsibility. But we know the histories of racism in this country. We know the history of colonisation. We should know it, and it's still happening. Yeah. And I think, Jackson, I should just say, when we, in our various talks recently, we were talking about how, I guess, demoralising and sometimes dispiriting it is when you see something like the IPCC report on climate change. And I'm sorry I bring that up because I can't think of anything equivalent in the prevention sector, when you think that that's made up and authored by 250 experts in the field, but we're still not able to make, you know, progress in that area. It is quite dispiriting. So what happens to us in prevention?
Well, and that brings us back to the importance of messaging, doesn't it? I remember in our recent conversation, we were talking, when you raised that, about, you know, we sometimes talk about the death of expertise and what happens, and we've seen it with COVID, people not being able to take on the evidence, not being able to process that, the conversation often getting stuck and us ending up in weird positions where communities are in conflict with each other rather than working together towards shared solutions. We're really hoping that the guides that we've released today is a way, and you know, the approaches coming in prevention, some recent work about engaging around masculinities and messaging that Vic Health has led there, that talks about that when we speak, when we use our words, that guiding our messaging, that different messages land in different ways, and we need to access and share that information as widely as possible, because we need to be able to speak clearly, and we need to be able to be heard, and we need to be able to speak to the parts of people, to their values, and to what we can all agree on, which is that we all, you know, deserve to live happy, healthy lives, that we are all going to be affected by these things, and to start to build a better conversation. Messaging is absolutely key to that. And, you know, we're just very pleased. I think this will just have implications for the work we're doing to prevent family violence, but across the board, we hope, you know, to build a more happy future for everyone. Not too broad a vision, but that's where we're at, I think, at the moment. Hope is so important right now.
You've hit on a good point, Jackson. So yes, messaging is key as part of the evidence base, and I guess, yeah, they go hand in hand.
And I think, you know, that brings up that interesting question of resistance. You know, when we say something, people sometimes, you know, people don't listen, or they don't hear, or there's some other value or goal that may be in the way. And I think that term of resistance, if I was going to say what's the most valuable thing I've learned since I became involved in this work, is that idea. And Sarah, you and I met when you were conducting your recent conducting research for Our Watch on behalf of Vic Health. On behalf of Respect Victoria, my apologies, on to better understand resistance and to build upon the practice and evidence in that space. And I think about my colleague, Belle, who said to me once so clearly, if it wasn't for resistance, everything would have already just happened and everything would be better now. And, you know, we've tried to address that in this guide, but obviously it's a bigger piece than one document. There's going to be a lot of conversations, a lot of workshops. And it sounds like resistance is a bit of a big conversation across Australia. Can you tell us a bit about, can you describe for our audience a little bit about what resistance is in this context of primary prevention?
Yeah, for sure. And actually, just as you were talking, I remember a quote from Richard Dennis, I think he's an economist, who says, evidence is what you tell powerless people to go and collect to keep them busy and to come up with an obscene veneer for your own action. And I think that that's just such a good quote of how, you know, resistance in the form of inaction is used to justify, you know, putting off or listening to evidence and best practice to kind of implement prevention based in that evidence. But thanks so much, Jackson. I think that the launch of the messaging guide today is just, I was reading it today and I was nodding my head the whole time I was reading it, because it's just, I think, going to be such a valuable and rich piece that contributes to the conversation around resistance and backlash. And so, as you said, you know, I led a research project for Respect Vic that was kind of really trying to build on the kind of nascent emerging evidence and research around resistance and backlash conducted for Vic Health, with a particular focus on organisations and institutions. And Our Watch's interest in backlash specifically is that it is identified in Change the Story as one of the reinforcing factors of the gender drivers of violence. So, you know, it is an important aspect that reinforces those gender drivers. And, you know, but we can see how resistance and backlash really cuts across other transformative movements that have goals towards equality. And I really like to approach thinking about resistance and backlash as, you know, when power relations are hierarchical and dynamics that are perceived as natural, traditional or biological, you know, when they come under threat due to social change, violence or the threat of violence may be seen as a justified response, you know, one that seeks to uphold the natural order of things, whether this is rigid gender norms and stereotypical constructions of femininity and masculinity, whether it's heteronormativity and cisnormativity,
you know, I think that there is going to be a reaction of resistance and backlash. And I really like this recent research that came out recently that kind of showed how at an interpersonal level, when relationships violated the breadwinner norm, that is of men earning more than women, there was a 35% increase in the likelihood of intimate partner violence and a 20% increase in emotional abuse against women. And I just remember reading that and thinking that was just such a good capturing of, yes, data and percentages and not the lived experiences of people, but I thought it was a really good indication of how just when women earn more than men, they do have a risk of increased violence. But you know, this kind of backlash doesn't occur only at this individual and interpersonal level, but I think really manifests within communities and workplaces, within organisations. I think it's embedded in policies and how the media reports on gendered violence and so on. And I like to approach it thinking about resistance and backlash to primary prevention, because primary prevention does take this whole of population approach across the socio-ecological model. I think people are far more likely to be resistant to the idea that they are part of the story. You know, they're part of the story because of the gender relations that structure our society, and that they may contribute to these drivers in subtle and subconscious ways in their relationships, in their homes, workplaces, social groups, communities, and so on, like you were talking about before, Emily. And I think, you know, few people, especially those who consider themselves to be non-violent or who have never been physically violent towards a person, they don't want to recognise their complicity in the drivers of violence against women or the drivers against LGBTIQ people. And I think many people do, you know, once that is explained, I think a lot of people do recognise the people to play their part. But I think, you know, this approach also elicits such a breadth of resistance. And I think, as this messaging guide highlights, it's not necessarily about saying like, no, we mustn't engage with people who are resistant. It's like, well, this is going to happen when there are going to be changes to existing power dynamics. Resistance and backlash is going to be present. How can you kind of, I suppose, where is the opportunity there? I suppose to speak to people and to educate people to kind of overcome and persuade that movable middle about the necessity to kind of address the gender drivers of violence against women, but also the drivers of violence against LGBTIQ people. You know, and I think just lastly, I think that when we think about resistance and backlash, there's this like more extreme and very, very deliberate form of backlash. But resistance is really a spectrum from these like more passive forms of denial and disavowal and inaction that I think shouldn't necessarily, they sometimes, you know, people, I think there's a tendency to go straight to men's rights activists, which definitely is a very important thing to address. But I also think there needs to be a broader conversation in the sector around, you know, these more passive forms of denial and disavowal, and where the, I suppose, the hooks are to kind of, I suppose, bring people along the kind of journey to recognise the gender drivers, essentially.
Oh, I love everything you just said. It's so much. We could have an entire event on all of these individual points, I feel. But the thing that really resonated for me there was just talking about how, you know, it can be challenging to identify our own resistance, and that resistance props up in this work for ourselves, both internally and also when we're encountering edges in our own work, things that may challenge we've all grown up within these systems. We've all been enculturated in these particular ways. We've all been complicit at various points in our lives, and that's a great place of acceptance and compassion to start from, and to then dedicate ourselves towards the shared values and the shared goals of improvement, and to really value, I think, critical reflection and moving past resistance, and how we can best support each other, rather than thinking about how you know, I've heard it once said, you know, we don't break down resistance. That sets up this polarity between people that isn't useful, but how to just support people in their resistance and support, you know, growing together and sharing ideas, to really think about, you know, the different forms of resistance, because there are so many different forms. And I really encourage, we've just shared the Encountering Resistance Guide. It's been around for a little while now, from Vic Health. It's a really valuable tool. There's some great graphics in there, some of which we've brought over and adapted it with permission from Vic Health. Thank you to them for that. in our own guides to help people identify some of the forms of resistance that they may hear in LGBTIQ work. We're looking forward to continuing to build on and innovate in that space. But we, sometimes just bringing up that menu is such a simple way of going, what do I think is going on here for me, and what do I think is going on here for others, and what are we going to do together to get around that and get towards something a bit more meaningful. Emily, we've talked a lot about resistance today and about how it works across the sector. Messaging is an important part of that as well, and I know in your work, that's messaging and campaigns and how we think about and talk about and communicate our ideas around prevention and around shifting those social norms. What kind of impact has this kind of approach had on prevention work?
In terms of addressing backlash?
Yeah.
Look, I think, just the concept of talking about backlash and resistance being actually different things is relatively, like the last 5 years new in the prevention field. And I think we're sort of still learning. There's a school of thought that you just don't talk about it. It's there and you work to address it, but let's not raise its profile. And then the other school of thought is, well, how on earth are you supposed to address it if you don't raise its profile and actively sort of try and target it? I think some of the things that I've learnt through this work, one is just, and this is probably common sense to anyone who works in any sort of social justice space, is really actively preparing for it. I think we've all got our own personal arsenals that you pull out. Sometimes at Christmas dinner is my usual go-to. Sometimes when you're talking to a politician, and there are the things that you're going to get when you say, you work in this particular field, and inwardly roll your eyes and then you reel out your messages. But I think you get it everywhere. You get it in a training room. You get it when you talk to a politician. Depending obviously on the stripes and background of that politician. When you pitch for funding. So I think preparing for it is a really critical thing. And I think while we're really good at doing we know we're going to get it from a person. One of the things that we're less good, I think, at doing. And that where I think the LGBTI sector can learn from some of the mistakes that we've made in the family violence sector, in the prevention sector in particular, is that we haven't really thought in a pre-planned way, I suppose, about the political resistance that we might get. And I don't necessarily just mean from political parties, I mean from the individuals who work within the bureaucracy who hold very similar attitudes, or individuals who work in schools. There's a heap of exceptional principals out there, and there's a heap of principals who hold really poor attitudes around gender just because they make up the rest of the world. So I think one of the things that that's really important to do in terms of that pre-planning is making sure that you're remembering that you get backlash resistance, I think, in particular at a policy level that's often very discreet and subtle. And I think that the fact that in some respects resistance is built into the political systems, I think, my early angry activist days would have said anyone who's resisting is wrong and they're bad and there's something wrong with them. And now I've grown up, thankfully. And yes, I get irritated, but I also have a response that is, I just need to work from the assumption after I've taken a deep breath that you are offering me whatever sort of resistance in all likelihood because you're personally uncomfortable, or you don't know something, or you've had an experience that means that you feel like you need to disagree with me. Not that you're without a doubt, there's the MRAs that Sarah's talking about who have an active campaign that is designed to undermine, and the same in the LGBTI space. There are people who actively, collectively work to screw us over. But most of the people, in a policy sense and in a personal context, fingers crossed, that you come across are actually having their own reaction. And it's about figuring out if you've got the capacity to sort of almost work them through in a series of conversations, recognizing that no one's going to turn around. This is, as we say, deeply really held stuff. No one's going to turn around. So, taking, little chipping away over time, I think is the one thing.
Yeah, I love the way you've described that. And I love that approach of just speaking, identifying their discomfort and noticing that, and noticing how your own reaction to that discomfort and what that can mean. And I do think the LGBTIQ what I'm really excited about in this work is bringing these structured approaches into LGBTIQ work. Resistance and backlash is the bread and butter of LGBTIQ advocacy. I think a lot of the people listening to us here today, and I certainly know a lot of my colleagues, are unacknowledged experts in this space. They have tremendous, often intuitive skill, or a skill that has been learnt through years of trial and error and teaching each other different ways of engaging and shifting these ideas. I think LGBTIQ communities are really experts in this work, and we have unfortunately, a long and deep history of responding to backlash, that more violent form as well, and what can happen when that, what it means when that comes up. One of the most amazing things that popped out for me when I read the Vic Health resource was around, when you encounter resistance, you know that you're in the right place, because resistance crops up when you're shifting something. It's the pushback of a solid object as you're pushing it out of your way and trying to make real change. And that we often talk about backlash as a form of resistance. I like personally to separate it out, because it is when you push something too far and something breaks, and then suddenly harm may occur. And when there's proactive, coordinated, or violent response, which we just know is a reality of sometimes of this work. And unfortunately, the internet has continued to facilitate that in some ways. And then that can occur both outside our own movements and within our own movements as well. And that can be a real risk, something we really need to plan for. And we hope that the guide, the principles that we provided in the guide, will be a way of really prompting people to sit back and have a think. I'm stepping into this territory, I'm putting a message out there, I'm hoping to inspire change or bring people on board, and to really actually plan for that, rather than constantly just running an unconscious process, which is often how LGBTIQ work tends to happen. And I'm really grateful for those frameworks. It's been very powerful for us. Regina or Sarah, would you like to add anything to that?
Might be a good segue into the next conversation, but yes, in relation to backlash and resistance, I thought I'd also just share, I guess, the hesitancy that I had, Jackson, when you'd asked me to come on as a panellist, because I felt, even though the Multicultural Centre for Women's Health, obviously we represent women from all backgrounds who are also migrant and refugee, including LGBTIQ communities. I just felt that my individual kind of expertise or lived experience in relation to LGBTIQ issues was lacking. And I guess that's another form of resistance, I think, that could easily sabotage the really good partnership work that we could all do together. And I think it's really important to just acknowledge, and to anyone out there who is feeling a little bit nervous, feeling that maybe they don't have the right to actually speak or participate on issues that they don't have lived experience of, is really, we need to be able to, we're working together to in fact amplify the voices of those who have been impacted. So I thought I'd just share that little bit in terms of those who are feeling that, look, I'm a bit scared, I may say the wrong things. What is the right thing to say in this situation? And I think the messaging guide will go a long way into ensuring that we have those difficult conversations, and also acknowledging that, the limits of our own knowledge within our particular sectors and organisations.
It's sort of a fundamental problem of prevention, really, is that what we're not just trying to talk to victim survivors of family violence or intimate partner violence, and we're not really just focused on individuals like you are when you're working in the response space, which is where a lot of us have come from. We are literally focused on the entire population. So we have to somehow have a conversation or somehow engage the entire population, which requires a radical different number of strategies. And without a doubt, people who are specialists in that field, terminology that I think lots of people shrink back from. And I really think it's important for us all to own our specialisation that each of us have, in terms of the depth of time that we've spent thinking and learning and talking and studying, and all of the things that you do when you work in a social justice space. But I think it's really critical that that expertise is recognised and that we actually use that to then have conversations with other people who don't hold the identities that we hold, or who, and we want them actually to talk on, if I'm talking about violence against women, really, it's not women who need a change, it's men who need a change. And they're the ones who, unfortunately, are going to listen to a bloke rather than me having the conversation. So I think that it's that real interesting balance that you have in terms of primary prevention, because we've got to find a way to talk to everyone, which makes our work just so much, or harder in a different way, I suppose, not so much harder.
Yeah, really well said. And I think we're, again, you know, thinking that's part of what motivated us around the guide, around providing that stuff around how to consult and partner so that you can move forward with confidence. You can have those conversations. You know, Regina, you and I have been building our conversation connection and you know, moving towards, you know, future work. And we've been, you know, by having that conversation beforehand, we can then model and share that with others as well. And bringing that, creating a container for those brave conversations is a really important part of this. We've heard a lot of feedback that people feel hesitant to step into this space. They're worried they're going to do the wrong thing, say the wrong thing, or even ask a question that will reveal a naivety that they're embarrassed about, or a curiosity. And, you know, which, you know, I always think, you know, that's wonderful to show that care and support. But often it highlights that there's this idea that there's this one-way connection, and actually this is mutual work. You know, the three of you here today, part of this is also about highlighting the importance of preventing violence against women as well. We need to share these ideas and communicate, and we need the support of the prevention of violence against women and family violence sector to achieve this gendered change. We think this is shared work, but we also have a role to play in challenging misogyny and sexism and gender inequality, both on behalf of women and behalf of ourselves as well, because these drivers are so intrinsically connected. It needs to be mutual, it needs to be two-way, and it needs to be robust. We need to be able to have these conversations, and we hope that that advice in the guide can really help. One of the emerging things that's come out of our work in this project is around partnerships as well, and around taking a more intentional approach to partnerships. And, you know, we raised earlier, Nothing About Us Without Us, which is a fantastic phase, came out of the disability rights movement and now has utility across a range of different movements. It just sums up the essence of that, you know, which is that, you know, we can't make decisions or do work or programs without the full and direct participation of that community. And in the guide, you know, we provide some steps about how that might look. But partnerships are another emerging quality. We partnered with DVRCV as part of our capacity building work, and that process was supported by a partner broker, someone who's, it's an approach that comes, you know, has a lot of utility in international development, where it looks at addressing issues of power and communication in that process. And huge thanks to DVRCV for that process. It was really transformational. And just for the last part, we've only got 15 minutes left, but I'd love, Regina, we've been talking a bit about partnerships. You know, what are your thoughts about partnerships, and, you know, what role do you see that taking in the future of this work?
Yeah, look, as I said, I think it really, all of us knowing that, and I think we can all acknowledge that we're not in the same boat. We are in different boats. But in saying that, I think we need to acknowledge that our knowledge is limited on our own, but together, I think we have a better chance of actually achieving those outcomes that we need for everyone in the community. And I think we need to acknowledge that there has been a lot of work. There's a long history of activism, feminist activism that's happened here in Australia and overseas. And I think we need to acknowledge that from the beginning, do our research on that. You know, cultures of equality, of violence, are never static. We have to look at the specifics, what's happening at a particular point in time. So I think we really, together, need to do that work of building an evidence base, and again, looking back at our particular histories in order to build that.
often think about, you know, that mutual learning. And I heard in a recent masculinities forum that Our Watch led, the representatives from Tangera in Northern Territory said, don't invite us to the table because you're trying to include us. Invite us to the table because we are experts on engaging communities. We are experts on building partnerships. We're experts on engaging men. We're experts on campaigning on centering the voices of lived experience, and of a range of different approaches and ways of thinking that you haven't even begun to think about yet. I was so inspired by that, and it made me think about the LGBTIQ community. I don't want anyone listening here today to think this is about us. You know, we're sitting here as students learning from, you know, in that mode as well. I think there's going to be a lot of opportunities for that two-way learning and partnerships. I think are a great way of approaching that. So many of my colleagues in the LGBTIQ space are experts on this, and are experts on some problems and issues that are perhaps haven't been addressed in the prevention of violence against women just yet. But by coming together and having these conversations, we can really break through that. And those shared conversations and spaces, Sarah, I'm just thinking about your work and Our Watch's work in practice leadership as well. And, you know, you've been working on the prevention hub model that Our Watch has been leading and promoting some of those really exciting conversations. And I'm just thinking as well, I'm really excited about bringing in LGBTIQ prevention workers as people start to more and more identify with that term and bringing this conversation into that space. Can you talk a bit about the importance of having those shared conversations?
Yeah, absolutely. I think the you know, having shared learning and having shared frameworks, and this speaks to what Emily was talking about right at the beginning, is that a lot of what we're hearing from stakeholders around the country is the importance of having that bedrock of concepts and you know, of having those conversations and having those debates and perhaps disagreements based around norms of inclusivity. You know, to kind of build that evidence base is really, really important. And I think the hub, the Primary Prevention Hub, is a really exciting space where there is that opportunity for that coordination and collaboration to really build that shared learning and shared frameworks further to have more inclusivity of the various sectors that, you know, are moving, trying to create a society where we can all live free and happy and equal and free from violence. And so, you know, I think the hub's a very exciting project. And granted, I've only been around there for less than 2 months, so still getting on my feet. But you know, I think it's a valuable tool nationally because, you know, obviously we've got so much in Victoria. But I think it's interesting to bring in voices from around the country as well.
Would this sort of what benefits will LGBTIQ people are interested in LGBTIQ prevention? What benefits do you think they might find in joining these communities of practice, these spaces? Both, I mean, you know, DVRCV, DVVIC have a range of different communities of practice and training opportunities. We'll be delivering our own training and community of practice opportunities. But those spaces, those workshops and forums, what kind of benefits would you see for the LGBTIQ sector in joining in those spaces?
Well, I think as has been referenced multiple times today, is this, you know, the mutually reinforcing, you know, learnings around preventing gendered violence. And I think that we don't want to waste precious time and resources around reinventing the wheel when we can draw learnings from across different sectors. I'm not sure if that answers your question, Jackson, but I think that there is a lot of value, and just as there's value for the prevention of violence against women sector to also engage in the prevention of violence against LGBTIQ people and communities. So, you know, I think that there is a reciprocity there that is that, you know, should be prioritized. But then again, I also think that needs to be kind of predicated on a very critical self-reflection around the own positionality of privilege that the prevention of violence against women sector has, right? And, you know, I think that also speaks to kind of what the Commissioner was saying around intersectionality. So I think you know, it's internal self-reflection from our sector, but also, you know, being inclusive and being welcoming for anyone that wants to have shared learnings. I'm not sure if Emily or Regina want to add in on that as well.
The thing that I would add is I think there's a piece in terms of the sharing information. I mean, I know that what I've learned through my conversations with Jackson and Marina in terms of developing some of the language within Change the Story is much better. Please don't ask me to do it right now, but usually much better way of explaining the interconnection between heteronormativity, cisnormativity, and gender identity and patriarchy, and sort of putting, I mean, Marina does it beautifully. And, you know, like, so some of those cross learnings, I think, in terms of really how to explain and articulate in a way for practitioners that relationship. But the other thing I think is what we found, you know, harking back to my time at DVRC, I think what we found through the communities of practice is that we used to do them on particular issues. We used to have one around this setting and one around this issue. And actually what prevention staff were saying to us is that prevention is the same anywhere. Yes, you need to tailor, but the barriers that you face and the hard bits about prevention work is isolated, and you do get backlash, and it is personal work. And the same strategies are used when you're talking about PVOR as opposed to when you're talking about preventing violence against LGBTI communities. So I think that there's some of that, the kind of conceptual framing of primary prevention is really similar. And I think that's for me is the thing that will hopefully will come out of those communities of practice and that kind of cross-pollination.
This forms all of this forms the foundation of this very project. You know, moving just above the guide, you know, this is the LGBTIQ primary prevention project, that where the work of this space has been about forming partnerships, providing guidance on the research and providing a vision for the future, and starting to really cultivate some conversations. We really strongly, the foundation of our work is around identifying how we can work together across these spaces as part of a greater whole. We are trying something mammoth. It's something profound. Small actions can absolutely create profound change, but the real permanent, you know, the real profound change that we're looking for is generational. That public health approach, that prevention approach of thinking about the long-term strategy. And I'm just so grateful for all of you for joining us here today. We're really hoping that the guide that we've brought to bear today, the evidence base that we've brought together, and the other work we're doing in training and resource development with other LGBTIQ organisations will begin a foundation for the primary prevention of LGBTIQ family violence that's not siloed, that's about walking arm in arm with the prevention of violence against women sector in the shared work of transforming gender across Australia. And just thank you so much to all three of you for your time here today. It's been absolutely fantastic, and we're really looking forward to sharing the recording after this. I also want to extend some other thanks to those who have contributed and played a key role in bringing this resource to bear. First, I'd like to thank our co-author, Roseanne Burston, who has been absolutely invaluable bringing their expertise to this guide and helping us bring this guide to fruition. Thank you so much, Roseanne. I'd also like to thank Mark Chenery, Alyssa Hill, our wonderful project committee, and the Department of Family, Fairness and Housing for their support for the project, as well as the support of countless others who have provided feedback, advice, helped us build our own capacity and learn about this work. This has been an incredibly fruitful and sustaining project. I'd also like to thank the Rainbow Health team and Marina for your leadership in this space. We're really looking forward to the next phase of this work, and we encourage you to, you know, if you haven't already, subscribe to the Rainbow Health newsletter to keep your eye out for future events of this nature and to continue to be part of this conversation. We'll be announcing some training in the coming months if you are interested in continuing to learn about this approach, and please drop us a line if you're interested in joining the conversation in other ways. Thank you so much to all of you for joining. We will have a feedback form. Evaluation is an incredibly important part of prevention, and this launch and this resource is no exception to that. If you are able to, we're going to just finish a few minutes early and a link will pop up to our feedback form. We'd love it if you could give us your feedback. It will also be sent out via email if you need to dash off. It will help us, you know, continue to improve the quality of our work and our messaging to you, those people whose work we hope to support into the future. Thank you so much, everyone. Stay safe, look after yourselves, and we look forward to welcoming you back again soon.